Hello, my name is Thomas Wright. I am a professor of orthopedic surgery at the University of Florida at Gainesville. Rehoboth is a company that is responsible for helping physicians find patient-specific solutions to their problems. And let me give you an example of this. In the United States, as the population is aging, there's been an explosion of joint replacements, including hips, knees, and in my specific instance is shoulders. Reverse shoulder arthroplasty is something that we do quite commonly now. The implant itself is not like a human being at all. The anatomy is absolutely flipped. And because of that, we don't understand muscle forces whatsoever, how it works around the reverse shoulder. Rehoboth Innovations has developed software solutions or surgical solutions that are very specific to an individual using a validated model. And the validated model is based on years of research from the lab that not only tells us where to put the implants based on the bony morphology, but it actually can tell us where to put them based on the patient's remaining musculature. Many other companies out there right now have focused on this, but they are very basic in that they have come up with patient-specific implants based on the bony anatomy alone. Where Rehoboth is separate from everybody else and light years ahead is that it actually understands the muscles that cross the joint, and by modeling it appropriately, they can lead the surgeon to tell us exactly where to put that implant with that particular individual's bony anatomy and remaining musculature. What this will do down the road, and should really help us with, is to markedly decrease complications. And even better than that is that we should be able to markedly increase their functionality. We should be able to get very consistent outcomes with the very best possible results, best pain relief, and best durability with the lowest amount of complications. That's what makes Rehoboth very, very special, because they have the data and understand muscles that cross the joint.
I'm Dean Cole. I'm an orthopedic surgeon in Orlando. My specialty is joint replacement. Rehoboth Innovations certainly has a niche, a very good idea, and some very important innovation that's going to allow me to provide the patient with a more specific joint for the patient's particular problems, the patient's particular anatomy, the patient's particular muscle forces. What I mean by patient specific is that I understand as the patient's surgeon their muscle forces, their alignment, the intricacies of their knee joint, shoulder joint, or hip joint. With that understanding, I can provide a better joint replacement that's going to feel more natural to the patient, a joint replacement that's going to last, and a joint replacement that's going to allow that patient to function at a high level and hopefully forget that they have a joint replacement. This is a very big advancement from where we've been with total joints, trying to average every patient. This allows us to be specific and have a better feeling joint that will last for our patients. So to me, it's a very big advance, one I look forward to utilizing and growing with the company. There's a tremendous amount of work to be done in this area. There's multiple joint replacements from the ankle, shoulder, hip, and knee that all will benefit from a better understanding of the particular patient's problems, anatomy, and muscle forces.
My name is Chris Roche. I'm the Director of Engineering at ExactTech for the Extremity Group, which includes shoulders. Rehoboth's patient-specific pre-op planning software, I think, has the potential to provide a lot of value to surgeons, to medical device manufacturers, and to hospitals. There are a lot of different implant devices out there, a lot of variety of designs, and there's a lot of different surgeons who have trained to various levels, and they may or may not be familiar with the different options they have, and having kind of utilizing computers to help improve efficiency and efficacy in the OR is potentially a very powerful tool, and I think Rehoboth's tool can lend itself to that. Basically, you could take a specific patient anatomy and navigate the various implant options out there and position it in the ideal spot for that particular patient, which can optimize kinematic function, maximize the possible functions that are available to that patient. And the hope is that the outcomes will be better with that improved function, and that the implant will last longer, the patient will be more productive, and the hospital will have less revisions. So I think that Dr. Walker's innovation in creating the software is potentially a powerful tool for surgeons and for a lot of different players.